Good evening everyone, I am Asif Siddiqui. Today we are here to discuss about stroke on the occasion of World Stroke Day on 29th October, and today we have Dr. Praveen Kumar Yadav, Consultant Neurologist and Chairman of Arogyam Neuroclinic. So sir, I am going to ask you some question regarding stroke and which will help us raise awareness regarding the same.
Sure.
How common is stroke and how to recognize stroke in our community, and what to do when somebody is having stroke like symptoms?
That is a good question. Stroke is a very common disorder. As we all know, almost 1 in 4 adults are having the lifetime chance of having stroke. So it is very common disorder, and according to the WHO, it is one of the most common neurological disorder which causes disability as well as mortality. So it's a very fatal and serious disorder which affects the human. Now, regarding the symptoms of stroke, it is a very important question for the community, how to identify stroke whenever in the community when you see your relatives or friends developing these symptoms. So, the most common symptoms which we see in stroke are, you can remember it by the acronym, that is B FAST. So, B stands for balance abnormalities. So, whenever there is sudden onset of balance problem in a patient, so this is likely to be a stroke. Second is eye abnormalities. So, in the eye abnormalities, for example, if there is sudden visual loss or sudden double vision, so that could be a symptom of stroke. Third important thing is facial problem. So there may be deviation of the face or some asymmetry in the face. So that could be again be a symptom of stroke. Other symptoms which are seen is weakness of the limbs, either weakness of the hands, for example, difficulty in gripping objects or lifting the arms, or difficulty in moving the leg, usually on one side. For example, the patient may not be able to wear the chappals, there may be slipping of the chappals, there may be dragging of the limbs. So this could be a symptom of stroke. And one more symptom is speech abnormality. So if there is sudden slurring of speech, which we call as unclear speech. So if this occurs suddenly, then this could be a symptom of stroke. So any sudden onset symptom of balance, of visual problem, of speech problem, of weakness of the upper limbs or lower limbs, and slurring of speech could be a symptom of stroke. So these are the red alarm symptoms. Whenever you see this, so you must immediately think this could be a sort of stroke and immediately rush the patient to the hospital.
Okay, sir.
As I mentioned, whenever you see these symptoms, immediately you have to act fast. Fast means you have to immediately rush the patient to the hospital. Now, once the patient goes to the hospital, there are certain tests like the CT scan of the brain, which will be done by the emergency department, and there are certain treatment of stroke which is available within the first 4.5 hours, which has to be given in a time-bound manner. So the patient has to be rushed immediately to the hospital, and the treatment has to be started as early as possible.
Okay, sir. Sir, my next question is, can stroke recovers its own?
Well, this is a very crucial question, and stroke can sometimes recover on its own. We very often come across patients who come with symptoms that they have developed some slurring of speech and weakness of the limbs, and within 10 minutes or 20 minutes the weakness has subsided. So this is called as a minor stroke, or in technical words we call it as transient ischemic attack or TIA. Now it is very important to know that these minor strokes, though it can recover on its own, this could be a forerunner of a major stroke which can occur in the next few days or months. So it is very crucial that whenever somebody has this symptom, that is weakness or any slurring of speech or any facial deviation, which recovers on its own within a matter of within 1 hour, then this patient also has to be treated as a urgent stroke and has to be evaluated by a neurologist or a physician as early as possible. So these minor strokes should not be missed because they can lead to major strokes in the future.
Okay, thank you, sir. Sir, my next question is, what are the type of stroke?
Well, stroke can be divided into two main types. First is called as a ischemic stroke, or in which the blood supply to the brain gets cut off transiently and there is a clot formation in the brain. So this is called as ischemic stroke, a stroke which gives rise to clots in the brain. Second is hemorrhagic stroke, in which the blood vessel ruptures and there is leakage of the blood inside the brain. So that is called as hemorrhagic stroke. Now it is very crucial to understand whether it's a ischemic stroke or hemorrhagic stroke, because the treatment is totally different in two types of strokes. The outcome of the patient, the improvement of the patient, and the risk to the life of the patient also differs in ischemic stroke and hemorrhagic stroke. So this differentiation is made by doing scanning of the brain, either CT scan or MRI. So it becomes very crucial whenever you see patients having symptoms like stroke, which I mentioned before. The patient has to be rushed to a hospital so that the scan of the brain can be done and we can find out whether it is ischemic or hemorrhagic stroke, and then the appropriate treatment for the stroke can be started.
Okay, thank you so much, sir. Sir, my next question, what are the risk factors in stroke?
So that's a very important question. So the risk factor of stroke can be divided into two types. One is which can be modified and second is which cannot be modified. So the risk factors which cannot be modified is, first is age. So age more than 50 or 55 is a risk factor of stroke which cannot be modified. Second is sex of the patient, whether it's a male patient or female patient. Third is the ethnic background which place the patient belongs. So that also predisposes to stroke. So that again cannot be modified. These are the non-modifiable risk factors. The risk factors which are very important and which can be modified by us are, most important is hypertension. So high blood pressure is one of the most important risk factors for ischemic as well as hemorrhagic stroke. So that is the most important risk factor which can be modified. Second is diabetes. Third risk factor is high cholesterol levels or dyslipidemia, which we call. The other risk factors which can be modified is overweight or obesity, which can again be modified. Cigarette smoking, alcohol intake, any sort of tobacco intake. So these are the common risk factors which can be modified by us. And one more important risk factor in this modern era is sedentary lifestyle. So that is lack of physical activity. So this is again a very important risk factor for stroke. So all these risk factors can be modified by us, and modification of these risk factors can lead us in prevention of the stroke.
Okay, sir. Thank you so much, sir. Sir, my next question, can stroke occur in young age?
Again a good question. Now when we think of stroke, we think that this is primarily a disorder of the elderly, that is the old age. No, it is not so. Now it is seen that almost 15 to 20% of the stroke patients are in the younger age group. So by young we mean less than 40 years. Now what are the reasons why young stroke is becoming very common? It is very important also because as we know that the productive age group of the population is in the young age, that is from 25 to 50 years. So if a stroke occurs in the young age, so it has a lot of impact not only to the patient but also to the family members, because most of the time the patient may be the sole breadwinner of the society for the family. So it has a huge economic impact on the family as well as on the nation. So young stroke is very important. The causes of young stroke is most important is all the modifiable risk factors which I have mentioned, like hypertension, diabetes, dyslipidemia, alcohol intake, smoking. So all these are becoming more and more common in the young population. So as a result, there is a shift of the stroke from the older age group to the younger age group because of the risk factors which are being changed. Second is, we must understand that we have seen patients even 2 years of age, 3 years of age coming with stroke. So there are certain genetic risk factors which can predispose to stroke. There are certain problems in the blood vessels which can occur at a very young age. There are certain disorders of the blood which can again give rise to young stroke. So young stroke is crucial because the risk factors of young stroke are different. So these patients who come with stroke at a younger age group has to be evaluated more. So they have to do a proper blood tests of the brain. They have to get their heart evaluated because many times they may be having some problem in the heart which is giving rise to the stroke. They may be having problems in the blood. The blood may be more thick or may have more tendency to form clots which may be giving rise to the stroke. So a young stroke means the patient has to be evaluated more than that of a patient of the older age group, because the risk factors of young stroke are different.
Okay, sir. Thank you, sir. So my last question is, how can be stroke prevented?
So at the preventive level, as we all know, in medicine, prevention is better than cure.
Yes.
So as we all know, stroke is a deadly disorder. So once stroke occurs, there is permanent damage to the brain. So there may be residual paralysis, there may be slurring of the speech, the patient may have balance abnormalities which may persist throughout the life, and there is not much cure for that. So the best remedy is prevention of stroke. So how do we prevent stroke? So whatever risk factors which I have mentioned before, suppose if you are a hypertensive patient, so you have to keep your blood pressure under control. It should be less than 140/90. If you are a patient just with hypertension, if you are having diabetes and hypertension, the blood pressure should be even lower, that is less than 130/80. So you have to maintain the blood pressure in target with proper medications, and also you should have a low salt intake diet. You should maintain regular activity, you should do regular exercises, at least do some moderate exercises for 30 days in a per day for 5 days in a week. Then if you are a diabetic patient, you have to control your sugars. Make sure that your sugars are within the normal range, your cholesterols are controlled. You should avoid smoking. We have seen smoking is a killer for stroke. We have seen many patients, young patients at the age of 20 to 25, who have developed stroke just because of smoking. So smoking is the most important risk factor, and when you are a smoker along with diabetes and hypertension, the risk increases tenfold. So smoking has definitely to be stopped. Alcohol intake should be reduced, and you should try to stop alcohol. Take a healthy diet, so that is diet rich in vegetables, diet rich in fruits. Reduce the salt intake, reduce the sweet intake, reduce the fat intake, and take normal protein. Do regular exercises, avoid excess stress and strain. Maintain your body weight within the normal limits. So doing all this and leading a regular healthy lifestyle, not only you can prevent stroke, but also other vascular disorders like heart diseases and other disorders can definitely be prevented. So I think prevention is the key to stroke.
Thank you so much, sir. Hopefully, the audience find it useful. Any other queries and question will be posted on comment section, which will be answered later.